Hi, I'm Steve Adubato. Welcome to One-on-One. I want to introduce you to one of the many health and medical experts we have who joins us on a regular basis. He is Dr. David Singh. He is an interventional radiologist at Holy Name Medical Center, who also heads up the Interventional Institute there, right?
Yes, correct.
Which has been in existence for 8 years.
8 years of Holy Name.
You've been there for the last three, heading that up?
Yep.
Let me ask you, this is interesting. The Interventional Institute, what is it and why is it so significant?
Well, the Interventional Institute is just the name of where we practice. My director, Dr. Runback, he sort of started that 8 years ago. The significance of it, it lends credence to the importance of the interventional radiology services in Bergen County and also in New Jersey, the type of procedures we do. So whenever we reach out to the public, it's a way of separating the IR section, interventional radiology section, in Holy Name from the rest of the surgical services that are present within the hospital.
And the IR piece, the interventional radiology piece, is huge. Now, we've talked to some of your colleagues in this field, but I want to separate your piece out.
Yep.
Women's health, right? Can we focus on that in this program?
Sure.
What are the key IR, interventional radiology issues as it relates to women's health that are so important to our audience right now?
Okay. Well, the main ones we deal with at the Holy Name are uterine fibroid embolization, or
say it again?
Uterine fibroid embolization.
Go ahead.
Or it's also called uterine arterial intervention.
What are we talking about in English?
In English, women with growths in the uterus that cause them to have dysfunctional bleeding or pelvic pain. Historically, these were treated with surgery, either hysterectomy or myomectomy. And women that don't want to have a surgical option and prefer a less invasive option, this is essentially a procedure where we devascularize those tumor growths.
Wait a minute. One of the other things
Big
about
words.
our health and medical series is every time a phrase or a word gets used that I'm pretty confident our audience doesn't know, I jump in. Say that word again.
Devascularize.
Devascularize,
Yes.
which is?
Well, in plain English, layman's terms, basically you have a tumor that requires blood.
Right.
And the vascular part of it. So when you remove that blood, you devascularize it. So by cutting off the blood supply to the growth, because of that, you infarct or kill the growth, reducing the symptoms she has to begin with.
And it's so interesting, your field has grown tremendously. This fibroid embolization is huge. How is it helping women? And by the way, what was done before that even existed?
Well, just to give you a background of what fibroids are, they're also called leiomyomas. So fibroids are growths in the uterus, and about 30% of women have these growths. Not all women are symptomatic. Historically, the treatments for these growths have been surgery, hysterectomy or myomectomy, and the post-operative recovery period is much longer with any kind of surgical intervention. Now, with technology came ways of doing things that don't require big incisions, and uterine artery embolization is a procedure whereby we access the arterial supply to the uterus via the groin. So if you feel your groin, your right groin, you'll feel a pulse. We enter the femoral artery, causing that pulsation in the right groin, with a small needle, and through that needle, a single opening, we advance a small catheter, which is no bigger than a spaghetti, into the uterine arteries, and we inject particles. The particles then flow, and they stop the blood supply to the fibroids and also slow the blood supply to the uterus.
Now, the recovery period has to be dramatically different?
It's dramatically different.
Describe it.
So the procedure takes about half hour to 45 minutes to perform.
That's it?
That's it. So once the procedure is finished and the blood supply to the fibroids is stopped, she will then begin to have some form of symptom. We call this post-embolization syndrome, whereby she has pain, cramps, just by cutting off the blood supply. Your body, in response to no blood coming in, send a signal to your brain and she has cramps. That's effectively controlled with pain medication, some form of narcotic. She goes home either that same day with pain medication, or she's admitted overnight into the hospital with pain medication. She'll be on pain medication for the next 3 days, and then by a week later, she's back to the normal activity.
Two things. By the way, I want to clarify. The director of the Interventional Institute is?
Dr. Runback.
Because you are part of that team.
Yes.
But he is the director.
Yes.
Clarify something else. The risks associated with the embolization process, what are they?
So the main one, if anyone do a literature search on it online, will be something called non-target embolization.
Non-target embolization.
What that means is basically my intent is to embolize the uterine artery. If those particles I inject go someplace else, it's non-target. you need a significant amount of particles in a different vessel to cause the blood flow in that vessel to stop. So non-target embolization is something we really don't see a lot of. The reason being is the uterine artery has a very distinct appearance, and with the amount of procedures we do, you're comfortable when you're in it. So when you inject the particles, you use X-ray dye to see where the particles are going. So the only way you'll have a case where there's non-target embolization is if you just don't know what you're doing, or if you're
You
just
got to
not
get
paying
the right
attention.
target.
Yes, but the target is so distinct that it's done pretty much across the country.
Doctor, in the time we have, help us understand something else. IR, right? What other ailments, what other medical conditions is in fact interventional radiology useful in helping, particularly as it relates to women?
Well, pelvic congestion syndrome in women's health is another area we focus on.
Pelvic
congestion syndrome.
Go ahead.
Couple words in there. One, it's pelvic, and obviously it's a disorder of the pelvic. Congestion, a backup, and essentially what this is a disorder of the veins in the pelvis. These veins become engorged, sort of like varicose veins in the leg. They become engorged, resulting in a heaviness, sensation of heaviness and fullness in the pelvis. Medical workup are oftentimes negative as a cause for it. The appendix is normal, the bowel is normal, so oftentimes primary care physician may be left scratching their head.
Like you can't see, you did the
can't
test,
see it because
I don't see
there are
anything.
engorged veins in the pelvis. So essentially what we do is we decrease the inflow of blood into the pelvis by embolizing the veins causing the pelvic congestion syndrome. Those are usually the ovarian veins, the veins going to the ovary.
When you got into medicine, right, into this field, did you ever imagine this technology would be available to you?
No. You know, I actually entered medical school, wanted to do be a primary care physician and internist.
Right.
And once I saw my first CAT scan and my first MRI, and using imaging, those same imaging modalities and X-ray to do procedures, it just opened a whole new door as far as, you know, the possibilities. I mean, interventional radiology as a service uses imaging to guide treatment. That's essentially what we do. And be it cancer, peripheral vascular disease, women's health, it's all image-based.
I got to tell you, Dr. Singh, we do a fair amount of medical and health-related programs, segments like this. Every time we do it, I know it's not just me who's learning something. I know our audience is as well, and I want to thank you for joining us and sharing your expertise. Appreciate it. Dr. David Singh, appreciate it. One-on-one will continue right after this. Thank you, Doctor.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, working for great public schools for every child, Wells Fargo, the Adler Aphasia Center, PSE&G, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons P.C. Horizon Blue Cross Blue Shield of New Jersey, making healthcare work. And by Bloomfield College, offering small classes and big opportunities since 1868. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey, and by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.